Now, DocPod's 3 myths in 3 minutes.
This is DocPod's 3 myths. Myth number 1, MRD, minimal residual disease testing, is too expensive for routine clinical use.
False. MRD testing is absolutely not too expensive for routine clinical use. I would say labs that are doing this type of testing, including Quest, have pretty robust programs in place to make sure we don't cause financial toxicity. You could have, again, the best test in the world if a clinician's not ordering it because they're worried that patients aren't going to be able to pay for it, then that's doing no one any good. So, we have strong financial assistance programs and other options to take care of patients if there might be some bills. This type of testing at its core is definitely more expensive than, just from a ability to do the testing. It's a more expensive type of testing because it is more complex. It takes sequencers and, very specialized lab personnel and processes. But we make sure that that's not being passed on to patients with, great programs.
Myth number 2, ctDNA cannot guide treatment decisions reliably.
That is also false. From listening to podcasts, circulating tumor DNA, especially with, these newer tests that are, very tuned in to looking for tumor. Some of them actually have tumor mutations personalized for a patient panel, like the Haystack assay that I'm medical director of. When something's found on those are very reliable that there's tumor floating around in the body. It's different than other types of tests because these are personalized panels that were made from that patient's tumor to look for tumor at very low levels in the blood. So if they come back positive, they're generally not coming back positive by accident. They're coming back positive because there's tumor floating around in that patient somewhere.
Myth number 3, genomic testing is too complex for oncology practices.
False. So getting education and resources out into the community to make sure that community oncologists can take the best care of their practices is really on the entire healthcare system. Quest have amazing ability to do that, and the infrastructure is really, arguably unmatched with the ability to do at-home patient blood draws, get information, and connectivity to, local offices and things. I mean, it's really just been incredible. So yes, it's not too complex for community oncology. Definitely leverage your educational resources and your, lab testing medical expertise, but, at least try to practice on guidelines. Someone that used to sit on NCCN committees, I'm a big advocate for at least practicing to guideline care, which is good for everyone at that point.